Hello, and thank you for joining us today again for the HPL seminar. Today, it is my pleasure to introduce our speaker, Maria Rodriguez, who is a master's student in biomedical engineering here at the University of Calgary. Maria completed her BSc in civil engineering at the University of Alberta in 2016, after which she spent some years working in construction, bookkeeping, and a few other things, before she came back in 2024 to the University of Calgary and started a master's. She is currently conducting research in this master's under the supervision of Dr. Brent Edwards, and her presentation today will be related to her work, which is titled The Effects of Advanced Footwear Technology Shoes on Lower Extremity Joint Contact Forces in Trained Female Runners. But before she gets into her presentation, outside of her research, she is a yoga instructor, is currently training for her first half marathon this summer, and she speaks both Spanish and French. But thankfully, her presentation is in English today, so I'll pass it off to her and you'll enjoy that presentation. So thank you, Maria.
Thanks, Ashna. Thank you. Yeah, I'm excited to share my work with you guys, so let's get started. So since 2016, advanced footwear technology shoes, often referred to as super shoes or AFTs, have been worn while breaking every world record in both men's and women's road racing. The most recent records broken were at the London Marathon, where Tidisa Sefa on the left finished her race at 2 hours, 15 minutes and 41 seconds, and Sebastian Sawe on the right finished his race at 1 hour, 59 minutes and 30 seconds. Sawe also broke the sub 2 hour marathon barrier, something many runners have been trying to do for many years. So what makes these shoes different to traditional running shoes? AFTs are well known for their highly compliant, resilient, and lightweight foams, and their curved carbon fiber plate embedded in the midsole foam, right here, that line in black. These two components work synergistically, but let's start with the foam. In a couple studies comparing polyether blockimide, PEBA foam, a common foam used in AFTs, with ethylene vinyl acetate, a common foam used in non-EFTs, or AFTs, PEBA foam. Those studies saw that PEBA foam deformed twice as much, it returned more energy than EVA foam, and it was less than a quarter of the density. For comparison, a styrofoam cup is about 0.075 grams per centimeter cubed. And you'll see here at the bottom that PEBA was 0.08. So that speaks to the low density, lightweight nature of the foam. So the second element is the curved carbon fiber plate. Studies show that by increasing the longitudinal bending stiffness of a shoe, it reduces the dorsiflexion that happens at the metatarsal phalangeal joint right here, and therefore reducing the energy loss at the metatarsal phalangeal joint. By adding a curvature to the plate, it reduces the dorsiflexion required from the ankle joint that would otherwise be required to overcome that bending stiffness. And the curvature also works quite nicely with the natural rolling motion of the foot from mid-stance to toe off. So combining these shoes work together to contribute to the improvement in running efficiency that is observed when running in AFTs. A study conducted by Hukamer and colleagues in 2018 compared 3 different shoes, so 2 traditional running shoes and 1 AFT at 3 different speeds. They were comparing the energetic cost of running, and they observed consistently an average on those 3 different speeds of a decrease of 4% in the energetic cost of running from these AFTs compared to the other running shoes. So in other words, when you run in these shoes, there's less of an energetic cost, or you can run faster for longer for the same energetic cost. So several studies have been, now that we know how the performance metrics happen with these AFTs, we are now more concerned with how they relate to running-related injuries, because running has a higher rates of overuse injuries compared to other cardiovascular exercises. There's one study that saw that running in AFTs had higher rates of running-related injuries at the hip, but another study saw that running in AFTs reported 50% less running-related injuries at the knee. And another prospective study following 141 runners reported that 41% of those runners experienced bone stress injuries, which is what this pie chart is looking at on the right. And 51% of those bone stress injuries were at the femur. So given the running-related injuries that we're concerned about, this kind of speaks to that. So a lot of these studies had a disproportionately high number of male participants, And a lot of the other studies done in AFTs also had a lot more male participants. And given that females have different proportions of running related injuries, so they have 40% of their running related injuries are at the knee, and they're twice as likely to experience bone stress injuries or a femoral neck fracture, kind of observed here, than their male counterparts. So regarding these injuries that we're concerned about with AFTs, females are a cohort worth investigating. There is one study conducted by Martinez and colleagues that looked at an all-female cohort. Their joint loading metric was joint moments, and they compared participants at a fixed speed. But a limitation of the study is that when calculating joint moments, it's challenging to infer the compressive and shear contributions of muscle forces on those joints. And by comparing subjects at a fixed speed, it doesn't account for the velocity gains that happen when running in AFTs. So by adding a different joint loading metric like joint contact forces and comparing participants at a subject-specific pace and at an AFT improved pace, we're able to kind of address those limitations. So the objectives of my study, the first objective is to quantify the effects of AFT shoes on lower extremity joint contact forces in trained female runners, and to compare the joint contact forces between a subject-specific 10-kilometer race pace and an AFT improved pace. My hypothesis is that the joint contact forces will be higher using the AFT shoe and even higher at 8% improved or AFT improved pace. I'm just gonna drink some water. So for our participants, we had 25 trained female runners. Our inclusion criteria was that they had to be between the ages of 18 and 45 years of age and have completed within the past 6 months either a half marathon in under 2 hours and 6 minutes, a 10-kilometer in under 59 minutes, or a 5-kilometer race in under 26 minutes. Those cutoff times I took from the 2025 Calgary Half Marathon women's race, and I took the top 30% of finishers, which was that 2 hour and 6 minutes cutoff time. And then I used the World Athletics points calculator to transfer that score over to an equivalent 10-kilometer and 5-kilometer pace. The exclusion criteria was that the participants couldn't have undergone a lower extremity surgery in the past year or sustained a running related injury that stopped their training for more than 1 week in the past 6 months. For our footwear conditions, we had a traditional running shoe, which was our Nike Structure 22. And because we were interested in joint injury and joint loading, we also had an injury reduction shoe, which was the Nike Infinity Run. For our AFT, we used the Nike Alpha Fly 3, and you can see here on the bottom that it was in fact lighter weight and had a higher energy return compared to the other two shoes. We compared those 3 shoes at 2 different speeds. So we asked our participants for their 10-kilometer race pace, and then we, through equations we used from Kip and colleagues, study done in 2019, we derived a percent improved race pace. So for our cohort, that averaged out to be around a 3.5% improvement or faster running velocity. For the runners in the room, the average 10-kilometer race pace was like a 5-minute, 8-second per kilometer pace, and the AFT improved pace was a 4-minute and 57 second per kilometer pace. We had participants come into the Human Performance Lab and run on our MoTech instrumented treadmill, collecting ground reaction force data at 3,000 hertz. We had a 12-camera Vicon system capturing motion capture data at 300 hertz, and those 2 systems were synchronized. We counterbalanced the shoe conditions and speed conditions to reduce any potential bias, and subjects had 26 reflective markers on their right leg and contralateral greater trochanter, anterior superior iliac spine of the pelvis, and posterior superior iliac spine. Each subject took a 1-second static trial so we could determine the neutral segment and joint positions. And we had 4 segments, so one at the foot, one at the shank, one at the pelvis, and one at the thigh. We measured subject-specific height, weight, calf circumference, thigh circumference, foot length, and foot width. And the remaining anthropometrics we estimated using equations from Vaughan. So I'll use my laser pointer here to guide you guys through our pipeline to get to our joint contact forces. So again, we use our motion capture data and our force platform data as inputs into our inverse dynamics calculations. Using segment masses and segment moments of inertia in those calculations as well, we were able to derive joint reaction forces and joint moments first at the ankle, then at the knee, and then at the hip. We then took a musculoskeletal model and scaled it to each subject's height and mass. And that allowed us to have the muscle length and muscle force velocity at each time point of stance. We then use static optimization where we minimize a cost function, the cost function being the sum of muscle stresses squared. And that allowed us to estimate the muscle forces, because the muscle stresses is muscle forces divided by the muscle cross-sectional area. A constraint of that muscle force estimation is that the moments generated by that muscle that crossing the articular joint should equal to the moments that we derived from inverse dynamics. Once those constraints are satisfied for a muscle force estimation, we vector sum those muscle forces with our joint reaction forces from inverse dynamics, and then we get our joint contact forces. The musculoskeletal model we used was from Arnold and colleagues. We used 44 muscles, and at the hip, we had 3 degrees of freedom, at the knee, 1 degree of freedom, same at the ankle, and at the subtalar joint, we modeled 1 degree of freedom for inversion and eversion at the ankle. Again, for joint contact forces, we vector sum the joint reaction forces and the muscle forces. We took an average of 30 steps per subject and interpolated it over 101 time points so we could get from 0 to 100% of stance here at the x-axis. This is just a representative subject. On the y-axis, you'll see we had our joint contact forces in terms of body weight. And for our statistical analysis, we compared the peak joint contact force values in the axial direction and the shear medial lateral and anteroposterior direction. Our statistical analysis was an analysis of variance. We used an ANOVA to compare 6 conditions. We have a significance level of 0.05, and for our multiple comparisons, we used a Bonferroni correction. In the cases that sphericity was violated, we also used a Hunsfeld correction. So for our results, there's a lot going on in these graphs, so I'll just walk you guys through a bit of an explanation. The first graph is comparing our 10-kilometer race pace. The second graph on the right is comparing our AFT improved pace. And then the x-axis, we have our traditional shoe, injury reduction shoe, and our AFT. And on the y-axis, you'll see our peak joint contact forces in terms of body weight. All the gray lines are individual subject responses, and the dark black line is the group mean. The blue dot is the traditional shoe, the green dot is the injury reduction shoe, and the orange dot is the AFT. Across all of our comparisons, you will see that there is a speed effect, meaning that the AFT improved pace resulted in significantly higher joint contact forces in all of our shoe conditions compared to the 10-kilometer race pace. So here we have our hip axial joint contact forces, and again, we see that shoe effect, but we don't see any, or sorry, we see that speed effect, but we don't see the shoe effect. In the shear direction, again, we see a speed effect, but we don't see a shoe effect. At the knee, you see, again, that speed effect outlined by these dashed black lines, and we see a shoe effect where the AFT resulted in lower joint contact forces compared to both the injury reduction shoe and the traditional running shoe. And we also see that the injury reduction shoe resulted in lower joint contact forces than the traditional running shoe. In the shear direction, medial-laterally, we saw no significant differences, although that speed effect was close-ish at a p-value of 0.064. In the anteroposterior direction, we saw significant differences in shoe effect, where AFT was lower than the traditional running shoe, and the injury reduction shoe was significantly lower than the traditional running shoe. And again, that speed effect compared to both speed conditions. At the ankle, we saw a significant difference where the AFT was significantly lower than the injury reduction shoe and the traditional running shoe. And the injury reduction shoe was significantly lower than the traditional running shoe. Again, we see that speed effect. In the shear direction at the ankle, medial-laterally, we see that the AFTs had significantly higher medial-lateral joint contact forces than the traditional running shoe. I attribute that to the fact that AFTs are a lot thicker in foam, so that kind of creates that medial-lateral instability. And the injury reduction shoe, also having a thicker foam, had significantly higher medial-lateral joint contact forces. In the anteroposterior direction at the ankle, we also see, or not also see, but we see a lower joint contact forces in the AFT compared to the other two shoe conditions, and lower joint contact forces in the injury reduction shoe compared to the traditional running shoe. When comparing our joint contact forces to our joint moments, we saw some similar trends. At the ankle in the sagittal plane, because that's what we modeled for the ankle, sagittal plane joint moments were significantly lower in the AFT compared to both the traditional running shoe and our injury reduction shoe. At the knee, we saw no significant differences in the sagittal plane between shoe conditions. And at the hip, we saw no significant differences in the sagittal, frontal, and transverse plane, again, because they were 3 degrees of freedom modeled at the hip, compared to the other running shoes. When comparing our spatiotemporal parameters, we saw no significant differences between shoe conditions in our stride length, stride time, or contact time, but we did see significantly higher flight time when running in the AFTs when compared to the other running shoes. For our step frequency, we did note that the step frequency was lower in the AFT, although it didn't come up as statistically significant. It had a p-value of 0.08. So in summary, AFTs do reduce joint contact forces at the knee and ankle. In blue here, when comparing the AFT to the traditional running shoe, you'll see that it resulted in up to a 5.2% reduction in joint contact forces at the knee and up to a 10.8% reduction in joint contact forces at the ankle. When comparing the AFT shoe to the injury reduction shoe here in green, you'll see a reduction in joint contact forces by 2.4% at the knee and up to 3.5% at the ankle. When comparing our speed effect, again, we saw that AFT improved pace, increased joint contact forces just across the board. So our AFT, or all of our shoes, increased in joint contact forces by between 1 to 2% when running at the AFT improved pace. And we also saw, again, that there was no significant interactions between the shoes because they all responded in similar ways to that increase in speed. So in conclusion, if there is an increase in injury risk related to running in AFTs, that's not associated with the shoe itself. It may be because of the increase in speed, but it may be other variables as well. For future work, something that I'd like to see or something that I'd like to measure are the performance metrics like joint work and joint power and center of mass dynamics. It would also be cool to see this study replicated in males, just so we can compare that male to female comparison. So thank you to Dr. Rick Edwards, my supervisor, my co-supervisor, Dr. Colin Furringer, to my undergrad Shineza for helping me with so much data collection, to my whole lab group to answer for funding me, and to all of you for listening. So thank you.
Floor is open for questions. Who would like to start us off? Well, Robin and then Darcy.
Thanks.
Oh, this will stretch.
Thanks, Maria, for the presentation. Do you think people can run at that AFT speed without AFTs?
Do I think people can run at AFT speeds without
Or maintain that for 10K, 20K?
Probably at a higher energetic cost. I'm sure they could if they trained for it, perhaps. But I think it would be at higher joint loading and a higher energetic cost. I don't see why not if they train properly for it.
Because one of the results I would like to see, and I think that could answer your question, is like comparing these two shoes at their normal speed
Mhm.
against AFT at AFT speed, because that's what will happen in real life.
Mhm.
Did you try just to compare that? I know there was no interaction, but like, do you think the stress at AFT speed for AFT shoes is like still lower than traditional shoes at like a lower speed?
Sorry, if I'm understanding your question, if anyone tried to compare traditional running shoes at a
Normal speed
normal speed?
with your AFT at AFT speed, because
With
that's
AFT
what
at
will happen in
AFT
real life.
Right, I mean, given that the traditional running shoes, we saw that they had higher joint contact forces, than the AFT, I see what you're saying.
Yeah, like your comparison can be just mixed together and just comparing three shoes at two different.
Yeah, that's good, that's a good idea, that's a good idea to run those comparisons, yeah, I could run those comparisons,
Yeah, I think of the data.
for sure, and I shall, thank you for that idea.
Hey, great job, Maria. Do you know if your participants ran their 10K race in the AFT?
Yeah, we made sure that they had their 10K pace, or that the 10K pace that they gave us was, not in AFCs.
Venus, so how did you get the PE cross-sectional area, the physiological cross-sectional area? Is it from the model?
It's from the model, yeah.
Okay, and so you scale it to the person, you look at you enter the height,
Yes,
okay.
yeah, we do scale the model to each subject's height and height.
Okay, and how reliable is this? Do you know, like, how reliable, like, differences between subjects, between people, like, how reliable is this generalization of just based on weight and height? Maybe activity, maybe, I don't know,
Like-
the muscles could change the relation angle, depending on what.
Right there, I mean, we do have some studies, I have a couple slides here. That compare the optimization with, compare the optimization with ENG data. And the optimization, being this dashed red line and the ENG data being the blue line. So although it's not exactly the same, that's kind of the model that we were running off of, so we felt satisfied with the comparison. But in terms of, like the error, I'm assuming what you're asking for, yeah, I'm not sure what the error would be. I think I'd have to do like a repeatability study and get one subject that I test over and over again and see what the variation is, within that subject.
And maybe also, like, I don't know, maybe when they did the model, they did that, like, some imaging of the subjects and the model, if it can predict the venation angle of the muscles and the physiological cross-sectional area of the muscle.
Yeah.
Like, how much, I'm sure they have done that, but just I was asking, like, if you have looked into this and looked, like, how accurate their model is relative to the actual imaging of the muscles and the physiological cross-sectional area of them.
Yeah, that's definitely
How
something I
they-
should look into.
yeah.
Yeah, that's definitely looking into.
Very well it is between subjects.
Mhm.
And males and females, if this was done, like this subject in males or in females, or.
Yeah, for sure. Yeah, thank you for that idea.
I think I just missed this, but which was your injury reduction shoe?
The Nike Infinity Run.
No, go ahead.
Kind of related to Venus's question, how did you handle the optimization in the different shoe conditions? Because I think, I remember Zach, when he looked at differences in stack height, he speculated that the higher stack, you're more unstable, and so you have more co-contraction to stiffen the joint. So how did you deal with potentials of different co-contraction and different conditions or different muscle activation patterns?
Yeah, so our stack height was one of the variables that we put in our MATLAB code. And I don't know if that influenced the co-contraction, because I know we had a fit factor to model the co-contractions. However, whether that fit factor is related to the stack height, that's something I should definitely check. I'm not sure if those were interacting.
Right, and what was the fit factor?
I think it was like 1.3, I believe.
I'm just not familiar what it is.
I think it's like a, I actually don't know. To be honest, I don't know. I'm not lying. I know the number it is, it was 1.3. And I think, yeah, I don't really know how it runs in the script.
Okay, coming back to my question about the injury reduction shift. Why did you call it like the injury reduction shift?
So Nike ran an internal study, where they compared the Nike Structure 22 to some of their other shoes. And because that shoe was designed with the attempt of it being an injury reduction shoe, but the participants in the study reported no significant differences in injury reports. Then when they ran that same study with the Nike Structure and the Nike Infinity resulted in a lower injury reports. So that's why we chose that.
Oh, online question.
There are two questions online. The first question is, should joint contact forces be adjusted for the speed, given that the ground reaction force are known to be higher at faster speed?
Should joint contact forces be adjusted to normalized to speed?
No, given that the GIF are known to be higher at faster speed.
It's in the model.
It's in the model.
Okay,
Reaction for it, they're in the model.
all right. Then question number two is, one of your conclusions was that the AFT may not be the main reason for increased injuries risk. What other factors could be influence this?
Based on my study, I can only speak to the speed. It might be the speed that's associated with running at these with running with these shoes. It might also be this wasn't something I did in the study, but it might also be just like this new shoe that people are using. If they're unfamiliar with the shoe, it might just increase.
This is my question, for curiosity. Does it everybody compare barefoot running with shoes?
With AFT shoes, yeah, there is a study that
Is there a
not
difference?
barefoot running, but minimal running, minimal shoes.
Okay. I just wondered.
Then Kat, a question back there?
Yeah, sorry, one of my questions earlier, do you know what kind of injury that specific shoe was preventing you for? Like, towards overall running injuries?
It was overall running related injuries, yeah. So they reported less running related injuries or less pain. So like the way they defined running related injuries was if the subjects stopped their training for more than a week because of pain. And then they just said that at specific joints, so at the hip, at the knee, and at the ankle. And in the Nike study, the running related injuries that we're seeing to be decreased, I believe, was at the knee. I should double check that. That's the answer.
Over how much time?
I think it was a 12-week prospective study, I believe. Again, please don't quote me on that.
No, was it
Just come to my office and we'll read it together, because I can't recall for sure, but it was over a series of weeks, training program.
First Armando and then Venus.
So you said something about the kind of like learning effects, just with one of the questions. So if you have someone that came in and like that's running the AFTs like maybe once or twice, could their joint reaction forces be higher because they're not used to the stack height or the carbon plate? Or lower, I don't know.
If they're running at the same speed, I would anticipate that joint contact forces would be the same. In the medial lateral direction, they might be different because that's where the instability comes from. But granted, if they had run an AFT once or twice, I feel like that would satisfy the familiarization effect. And I guess like running them once or twice, like, is it like running 10 steps or was it running like a proper run? Because it
So
really
in your
depends.
study, they would all be familiarized because they all ran races in their AFTs?
We had them warm up in the shoe, maybe not warm up, but run at that speed in the shoe for 2 minutes, before we recorded or collected data.
Venus had a question and then Benno.
So I was looking at the results and I when you say there's a speed difference, it's not that obvious in the graph.
Yeah,
In the graph.
yeah.
You have the same scale, right? The same
Yes.
y-axis scale.
Yeah, it's not,
So how did you, like, I'm not sure if Robin was asking that. Is it like you combine all shoes in the same speed to compare to find significant difference? This
Yeah.
is how the, okay, so it's just two groups that you're comparing instead of six?
No, it would be, maybe I misunderstood your question. So, in SPSS, we just put all of the data, so all the different shoes running at all the different speeds. And then we were able to compare just the shoes, and then just the speeds, and then compare the shoes and the speeds to see if there were any interactions, which we didn't find any interactions. Does that answer your question?
Yeah, just I'm wondering, because it does not look that different and the data is really variable, so
Yeah.
I'm surprised that it is significantly different.
Yeah,
Within subject design,
It's within subject.
yeah, so that variation you see is between subject, that's not part of the statistical analysis agnostic.
Okay.
It's the change that matters within.
Within the same thing. Hello?
So you assume that the forces are the reason for injuries.
yes.
Do you have any evidence for that?
No, I think it would be, it's just I guess all these joint loading metrics are just trying to estimate, load at the joint.
Or you think because you can calculate it, you should have a, you know, I would suggest it's not the forces.
Hmm.
So what do you say to that?
I would think it is because, because, a lot of studies have run joint moments as a, joint loading metric. And joint contact forces are typically higher than joint moments. Now I guess that kind of circles back to the question of how do I know that joint moments are a metric of injury?
Let's say more general loading.
Mhm.
You say the mechanical loading
Mhm.
is the reason for the injuries.
Yes.
I say mechanical loading is not the major reason for injuries.
This is when you probe the audience member for more information.
What is?
So what is? So I guess
What is the difference in forces that you have measured?
what's the standard deviation in the forces that I measured?
The difference between the different conditions?
I
You
think-
said 3% or 2.5%, something like that.
Yeah,
Bring up the slide.
let's see.
So do you think that 3% difference
Well,
in the force or in the loading could be enough reason to produce injury, while the 3% less would be enough reason to not produce injury?
Perhaps injury was a irresponsible word for me to use. I think it is just a objective measure of joint loading, but whether that measure is directly correlated with injury, I think there are so many different variables that are affecting whether a person gets injured or not.
But your question was, how do these forces
Yeah.
affect injury?
My question was how AFTs impact joint contact forces.
Because they are important for injuries.
Because it's reflective of joint loading. But I think perhaps using the word injury in this presentation perhaps was a little irresponsible because there's so many things that impact injury. So thanks for highlighting that.
Okay, so one of the things that, so what I'm hearing, one of the things that you think can influence injury can be joint contact forces, and you're measuring to see whether the speculation or the comment that AFTs can increase injury risk is because they might be increasing joint loading. And from your study, you're eliminating the part that the joint contact forces are not going up in the AFTs like that. It's the speed effect, right? So I think that's where maybe both of you are saying kind of the same thing, but then Benno's question being that, is that part of your assumption when you're measuring joint contact?
Can I ask
forces?
a question? It's kind of related to this. Can you get a running injury by sitting on your couch?
No.
Okay, so I'm gonna say that it is the force.
And I think with AFTs, like the interesting thing is that you already made this comment in your presentation that like with AFTs, people are probably running faster. Right? I also think they're running more and more people that weren't running before because they're running easier, they're running. And the more running with higher speeds and higher joint contact forces during those runs and not having maybe adequate rest between those and the remodeling of the bones, then that is what I think it's kind of an additive effect. Which again, I'm also speculating, but I think that all kind of comes together maybe.
So when you measure these values, I'm sorry, you must have missed it in your methods. So did you measure when exactly when people were running? Like, is it after how long?
Like after, they ran for 2 minutes and then we collected the data for 30 seconds.
So what do you think happens if they are to run a marathon? If they are to run for longer time? What would happen to these forces and so fatigue effect?
Yeah. I had come across some study where fatigue effect actually decreased the joint loading in runners because they changed, I guess, like the biomechanics of the way they run. So I anticipate that that's how this like that's how that would affect this data as well. If there was fatigue, I think it would decrease the joint contact forces when
But
we
would
measure
increase
it.
the injury.
But it could increase the, I mean, it could perhaps.
Right.
No,
Why?
I'm pretty sure you didn't, right?
Huh? Why? Why are we saying, why do we assume these things? Why do we assume that you get injured when you're fatigued? I wanna see that research.
No,
So the interesting thing is that when you take all the studies that I've done about injuries and running, it's basically no difference between the different situations. So that suggests to me that maybe something else than the mechanical load.
Yeah, it could be.
And I think Van Mechelen has published a study in the 90s where he showed something like that the mechanical loading is not the reason, but that the training regime is the reason. Something like that.
Yeah.
You know, if you are philosophizing, if you look at the performance, not the injuries, it's the same problem. You know, you have quantified a lot of things that relate to performance. But if you take the new Adidas shoe, what is different in that new Adidas shoes that is really different to the Nike Vaporfly? What is different?
What is like in the current Adi Zero series, the ones with the energy ring? Is that what you're referring to?
No, the new Adidas shoe that they use for the elbow checkers.
One you showed on slide number 1.
Yeah, what's the main difference between that and like the Nike Vaporfly?
Yeah.
I know that that Adidas shoe, they don't use a carbon fiber plate in the same way the Nike Vaporfly does. It's also incredibly, they use a energy rim, so they don't have like the center in the plate. But I think the biggest thing is how much lighter it is. That's like the biggest reason difference.
And the difference is more than 1%.
Mhm.
Because it's about 100-gram difference.
Mhm.
So you would assume that it's 1%.
Yeah.
But performance difference was more than 1%.
Oh,
Much more.
so there's something else there.
Well, that's assuming the shoe does all the work. Shoe's the sole reason for performance change. That's assuming that the shoe is the sole reason for the performance change.
Right.
Yeah.
It's probably not the case.
Exactly. Good.
All right, anyone else have questions for Maria? Okay, if not, let's thank her for her talk.